All right, so in 2016, when Colorado was considering a ballot measure to make the state the first in the country to have universal government-run health care, you came out against single-payer health care, saying that, quote, it would be premature to dramatically remake our health care system at this time. How do you expect voters to choose you over some of your contenders, like Bernie Sanders, who have had a consistent record of support for single-payer health care over their careers?
Well, thank you, and I appreciate that. In Colorado, and one of the things that we've done, I think, as well as any state, I've been able to bring people together who were on different sides of the fence, in many cases feuding, and find collaborative solutions. And I think, you know, we're at almost universal coverage in Colorado. We're about 95% coverage. And we did that by expanding Medicaid, by creating one of the most innovative and successful healthcare exchanges in the country. I don't agree with Senator Sanders' the single-payer approach that you're going to have Medicare for all. I understand that we need a public option. I understand to get to that 100% coverage. I mean, let's be honest. Healthcare should be a right, not a privilege, right? And I will do everything I can to make sure. I believe that. I've worked for that. I helped start a community health center in 1973, and we said back then health care needs to be a right, not a privilege. I want to support any way we can get to universal coverage. That should be our first and primary goal. It should be our North Star. But I also recognize that there are north of 150 million people that have private. I mean, how many of you now have insurance through your you or a family member have insurance through your place of business, right? I mean, there are over 150 million people that I can't imagine how we would pull them off of health care coverage that in most cases they like. I am more focused on how do we, A, make sure we get to universal coverage, and make sure that we use, if it's Medicare, which I think is a good choice, or even Medicare Advantage, where you have different solutions and opportunities available, maybe more cost-effective even than Medicare. How do we make sure that we get to that universal coverage, but at the same time maintain and improve quality, and ultimately look at controlling costs? I mean, in the end, the last 30 years has been a spiral of medical inflation. And whether we look at transparency, if we look at preventative medicine and healthcare, we've got to be addressing this as a whole country.
Thank you very much.